Welcome to Spotlight. I'm Terry Harrington, and I'll be speaking with Joe's Kottoor. Today's show is sponsored by the Lake Huron Medical Center. Joe's, I guess congratulations are in order for Lake Huron Medical Center, aren't they?
Thank you, Terry. I appreciate that.
So 7 years now, you've been awarded the Healthgrades Award. Tell us about that and what that means for the hospital.
So Healthgrades is an organization like so many others who actually looks at hospitals all over the country, looking at their patient safety issues or patient safety grades kind of things. So one of the things Healthgrades has done is that they have actually looked at about 14 specific, items. For example, patient falls, infection rate, mortality rate, all those things, they kind of categorize them. Then they compare that with the hospitals across the country, whether it is a medium-sized hospital, small hospital, or a large hospital, or any of those kind of things. Then they take about top 100 hospitals. So Lake Huron Medical Center has been awarded this, recognition to be a hospital where patient safety is, important for them, and they rate them as one of the top 100 hospitals. One of the things, Terry, just wanted to talk about patient safety a little bit in a different level, because when patients come to our hospital, they are always looking to have safe care there. They are trusting us with the care. So at Lake Huron Medical Center, we take patient safety and quality of care very seriously. On a regular basis, our providers, physicians, and employees are so much more aware about patient safety, and they take steps to prevent any kind of adverse events for our patients. One of the things we usually do is that every day morning we have a safety huddle. There we actually bring in all the leaders or all the representatives from all the hospital departments and look at safety issues which has happened. Anything related to patient safety issues has happened last 24 years, and is there any potential for anything to happen for the next 72 hours? If there are issues there which has happened in the previous 20, we fix them, process them, look at it, and make sure that that doesn't happen in the future. If there are potential hazards for the next 72 hours, we look at them and say, how can we prevent them happening again?
And this really speaks a lot about your staff and what they're trying to do each and every day.
That's correct. So our staff are actually really motivated to do that. One of the examples is that recently we have done a patient safety survey last November, 2024 November. In that area, our staff has rated the hospital management and leadership high in their awareness of patient safety. Then also they are able to say that they are actually able to report any kind of safety errors to the management, and we are able to take action on that. So they are actually so much more involved, and I rightfully think that we as a hospital has done a great job in maintaining the safety of the patients and also providing safe care for that. And I strongly believe that our community deserves that. Our families and patients actually trust us with safe care for their dear ones, and we want to make sure that they get the safe and quality care.
I was going to say, more important than just for the hospital, that really is important for your community, isn't it?
Exactly, that's right. So that's why we actually look at all those safety factors. Some of the preventative or some of the initiatives we have taken to making sure that we provide safe care is, I already talked about our safety huddles. Then every patient who comes to our hospital is given a fall risk assessment. So that means that nurse goes into them and makes sure that they're rated what is the risk for these patients to fall in a hospital. So then based on that, we actually take preventative steps for making sure that our patients are safe and they don't fall. That's one of the things they have actually continues to do. Then our infectious disease physicians and nurses making sure that they do daily rounds to make sure that our catheters are safe, our environment is safe for to prevent any kind of infections and things like that too. So there are so many other initiatives, so that way our patients are safe. That's one of the reasons Healthgrades has awarded this recognition for the last 7 years or so.
And just to think that our own local hospital has been able to accomplish this 7 years in a row, at least being honored for it for 7 years in a row. Doesn't mean you've just been doing it for 7 years, right?
Exactly, right.
So what do you see as the future for Lake Huron?
I think our future, we are excited about the future. There are new programs we are doing. We are partnering with our physicians in the community. And also, I think one of the other things is our emergency rooms are safe, and our emergency room, the turnaround times are better, and we provide quality of care. So, it is reassuring to the community that, there is a hospital in the community where they can be trusted, or they can actually go and get best care in a timely manner, appropriate care, and best quality of care.
Well, Joes, we want to thank you for sharing with us on Spotlight, and congratulations again for your 7th straight Healthgrades Awards, recognizing you as one of the top hospitals in the country.
Terry, I am thankful to the community, and I am honored to be a part of Lake Huron Medical Center, and I'm also humbled with this recognition and awards and things like that. Thank you for your time.
And we want to thank you for joining us on Spotlight.